name is Anu Agby, and I am a PACE student here at Miller Career Technology Center. And at my internship, I was with a neurologist, and one disease that I spent a lot of time seeing and that really struck me was Parkinson's disease. So in my project, I decided to delve into, as it says, a new perspective on Parkinson's by focusing on how to properly diagnose this disease that is often misdiagnosed or undiagnosed. So what is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder in the brain in which you're not producing enough dopamine. So by your body not producing a proper amount of dopamine, your body starts to suffer and you feel tangible symptoms such as rigidity of the muscles, bradykinesia, slowed movement, as well as impaired gait where you're not walking properly. So there's also some really important stats where 1% of the population over the age of 65 has Parkinson's disease, and that goes without the proper diagnostics that I mentioned earlier. So already we know that 1% of the population has PD, even though it's not properly diagnosed. There may be a lot more. So why is it not properly diagnosed? There are several other diseases that share similar symptoms with Parkinson's disease. For example, essential tremor, the shaking of the hands, is a key symptom of Parkinson's disease. Normal pressure hydrocephalus, a condition in which fluid is in the head, also shares the symptom of slowed speech and gait instability, a key symptom of PD, as well as dementia with Lewy bodies and multiple system atrophy, which both highlight the bradykinesia that you find in Parkinson's disease. So since these symptoms are can cross multiple diseases, it is difficult to properly diagnose it. So that's why a majority of my project was focused on creating a proper diagnostic plan. Through my proper diagnostic plan, I highlighted the top 7 symptoms: bradykinesia, slowed movement, resting tremor, rigidity of the muscles, impaired gait, urinary dysfunction, bladder leaks, insomnia, and anxiety as the top 7 symptoms that you should look for in culmination to properly diagnose PD. So by looking for these diseases and asking the proper patient-centered focused questions of what is your family history with PD, how do you sleep at night, as well as the rigidity of your muscles, have they changed over time? By asking those proper questions and looking for a combination of these symptoms, you can ensure that you have properly diagnosed your patient with PD. Furthermore, implementing the project. Now that I have my proper diagnosis, I can use that to implement it within multiple regions. So by doing so, I can create a proper infographic in which the information contained is in a pretty organized fashion that the general public can understand, and by them being able to understand the information presented, they will be able to share it with their family and friends, be more comfortable to talk about it with their doctors, and be in a position where they actually can maybe be able to just use information in a more proper and important fashion. Furthermore, I would share it with neurologists and general physicians in smaller towns who may not have the general resources to know how to diagnose Parkinson's disease. And by giving them my report as well as that infographic, they can be able to be more versed within the field. So what is this whole purpose for? By using all of these information and by taking the important symptoms and cultivating a proper diagnosis, you can finally give your patient the DAT scan, which allows them to confirm that they have Parkinson's disease. Instead of giving every single person who you suspect has PD that test, you can be certified that the people who are getting that test will have proper confirmations. For you do not want everyone to have this test, for it is quite expensive, ranging from $1,500 to $3,000 per test. So in conclusion, Parkinson's disease is a disease that can be easily treated when diagnosed on time, which is why it is essential that you focus on the key symptoms, ask the correct questions so you can provide your patients with the best healthcare possible. Thank you.